Hi, my name's Hayden, and today I decided to speak to everyone about the American Stroke Association. They're a vital nonprofit organization dedicated to reducing the number of disability and deaths from a stroke. That is exactly why I chose them as the nonprofit I wanted to educate and inform people about today. Suppose you're searching for a way to make a substantial difference in the lives of countless individuals and families around the world by donating to a nonprofit. In that case, this is one I'd urge you to consider supporting. The American Stroke Association, also known as the ASA, was established in 1998. It is a branch of the American Heart Association, also referred to as AHA. Their main and primary goal is to help treat, try to prevent, or beat a stroke, also known as a cerebrovascular accident, CVA, or a brain attack. They receive funding for research through donations. They advocate for public health policies and work to provide resources with the help of millions of volunteers. They provide essential resources and education that enable people to recognize the signs of a stroke as quickly as possible. Awareness is very crucial. With your support, the ASA could expand its outreach programs, guaranteeing more people know the warning signs. For using FAST to learn and remember stroke signs and symptoms, which stands for F, face drooping. You should ask the person to smile and note if one side of their face is drooping or numb. A, arm weakness. Ask the person to raise both arms. Does one of their arms drift downward or feel weak? S, speech difficulty. Ask the person to repeat a simple phrase or sentence. Is their speech slurred, difficult to understand, or are they unable to speak at all? T, time to call 911. If you observe any of these signs, you should contact emergency services immediately. When it comes to treating a stroke, time is an extremely important factor. These initiatives are what can shave off hours, minutes, and even seconds between when a stroke begins and when the patient gets to receive the help they need. The ASA emphasizes the phrase time is brain, highlighting that the longer the brain is untreated with a stroke, the more substantial the potential damage can be done to the brain tissue. A stroke is clinically defined as an acute episode of focal neurological dysfunction that persists for more than 24 hours. Within that, there are two different types of a stroke, ischemic and hemorrhagic. Ischemic strokes are 85% of all strokes and can normally occur when a blockage appears in a blood vessel. This can result from a clot that develops in the arteries supplying blood to the brain or a clot that travels from another part of the body, which results in a restricted blood supply to the brain. Whereas hemorrhagic strokes occur when a blood vessel ruptures, causing bleeding in or around the brain, which could be potentially caused by such conditions as high blood pressure or an aneurysm. Experiencing a stroke can put you at an increasingly higher risk of having another one, making awareness and learning prevention a crucial key to preventing. However, you or the person you care for can mitigate the risk by identifying and coming to understand what caused your stroke, along with uncovering all the personal risk factors such as hypertension, diabetes, smoking, lifestyle choices. They all contribute to one thing: cardiovascular health. The American Stroke Association plays an extremely important and pivotal role in educating the public with the knowledge to understand a stroke and recognize the warning signs to know when to seek immediate medical attention. This will ultimately lead to the future looking brighter for potential stroke victims as well as those who have already fallen victim to a stroke. Strokes today are the number 2 cause of death in the world and the leading cause of disability. Learn the signs and how to help today. The more help from volunteers and donors they can receive, the more help they can give to people out there who truly need it. The more people can become educated to one day help possibly prevent a stroke from causing too much life-changing damage. You could help even with the smallest donation. Every amount counts. In addition to another option to help, you can volunteer your time to help spread awareness and educate others. Thank you for listening. Have a great day.